Good afternoon, Honorable Ministers. Thank you for taking the time to hear our presentation on Sleeping Rough, a Community Crisis. My name is Kate Paik, here with Nora Elgarbawi and Alana Dunlop from the Ministry of Municipal Affairs and Housing, which, as you know, leads responsibility in this area. We're joined by Alicia Davis from the Ministry of Children, Community, and Social Services, and Katie Laukas from the Cabinet Office. As a team, we bring a whole-of-government approach through the active participation of various ministries with direct interest in this complex issue. Next slide, please. We are presenting today from the City of Toronto, acknowledging that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is home to many diverse First Nations, Inuit, and Métis peoples. We're also reminded that Indigenous peoples only make up 5% of the Canadian population, but are highly overrepresented at 37% of rough sleepers. Next slide, please. Currently, Ontario has a crisis on our hands. 750,000 Ontarians are in core housing need, and approximately 10,000 people are experiencing homelessness across the province, at least 1,500 of whom are rough sleepers. The number of people living on the streets and in encampments across Ontario is increasing rapidly, resulting in a rough sleeping epidemic. Ongoing efforts have been inefficient, failing to meet the diverse needs of rough sleepers and their surrounding communities. Next slide. Despite government efforts over the years, there remain key obstacles that have prevented a successful end to rough sleeping. The first is a lack of comprehensive data on rough sleepers specifically. Most of the existing information is on homelessness more broadly, but even among those numbers, it's difficult to understand the individual circumstances leading to unhoused situations. This is particularly true for Black, Indigenous, and people of color who are overrepresented among rough sleepers. The broad range of circumstances make it difficult to target programs effectively, and according to the 2021 audit from the Office of the Auditor General of Ontario, this obstacle results in an imbalance of on-the-ground services, where some areas get assistance and others are neglected. Next, funding sources have also become stagnant over the years, failing to match inflation rates, increased costs of living, and the effects of COVID-19. Lastly, there's a disconnect in maintaining strong partnerships between NGOs and government sectors. Next slide, please. Rough sleepers primarily sleep outdoors and usually experience homelessness. They often have no other choice, but in rare cases, they might choose to do so in order to stay closer to their communities and within encampments. I'll now introduce Sierra. She has left her abusive partner, losing her housing and income support, and is now sleeping rough. Throughout her difficult circumstances, she began to develop alcohol dependence, causing her to lose her part-time job. She found refuge in her community within a local encampment, but was forcibly evicted from the area. And whenever she tried to get back up on her feet, she was denied employment due to having no address. Sierra is just one of over 75% of people dealing with homelessness who have at least one health issue, ranging from mental health to physical disabilities. She's also a victim of family violence, one of the main factors that lead to unhoused situations, especially among women. All of these issues leave her isolated and vulnerable to the high risks of rough sleeping. Next slide. The surrounding communities around encampments are specifically impacted. They have legitimate health and safety concerns around the presence of drug use, needles, and increased fire hazards nearby, especially for those with kids. Forced evictions of these encampments are not a permanent solution, and 72% of Canadians feel it's urgent to end homelessness. So we know that public support for these initiatives are in place. Going forward, development of comprehensive solutions in close consultation with the affected communities and rough sleepers themselves is critical. Next slide, please. In addition to economic costs, the human costs of rough sleeping are unacceptable. Coming back to Sierra, she'd encounter each of the emergency resources outlined in the graphic. As a rough sleeper, she's often in and out of emergency shelters. She's receiving emergency mental health services to aid recovery from her traumatic relationship and alcohol dependency, and she would have faced community police during the encampment eviction. From Sierra's case, it's clear that these costs are inhumane to rough sleepers and also a waste of resources towards the larger issue. Given that the average annual provincial spending on homeless-related programs was $356 million over the last 5 years, it's time for a better return on our investments while helping the province's most vulnerable. Next slide, please.
To respond to the growing crisis, we've assessed 3 comprehensive options. Our first assessed option would enhance the capacity and the operations of community service organizations by establishing a quality management framework through the Gold Star certification program. Our second and our recommended option is the ARC strategy, or the Accelerated Responsive Community Strategy, which is designed to provide wellness services and transition rough sleepers into housing as quickly and efficiently as possible, with wraparound on-the-ground supports in place. And our third strategy is the Prevention First program, which is a longer-term initiative that's designed to increase Ontario's supply of deeply affordable housing. Next slide, please. One of the main challenges that rough sleepers face is that community service organizations often don't have the capacity to meet their individual needs. The Gold Star certification program mitigates this issue by establishing a standardized quality management framework by which these organizations are evaluated, while incentivizing collaboration and coordination between them. It also gives them the tools to achieve success. While this option is viable, it would be limited in its immediate impact and doesn't provide the on-the-ground support that we know is critical to address the situation right now. Our second alternative option, the Prevention First program, spurs the creation of more deeply affordable housing throughout the province and provides support to tenants and landlords through the Stable Tenancy program. This would be a longer-term initiative that would address the affordable housing shortage in Ontario, but it would require a greater upfront investment from the province. Next slide. After an evaluation of each option, we strongly recommend the implementation of the ARC strategy. This would engage with rough sleepers to provide rapid access to wellness, housing, and career building services. If approved, 9 mobile wellness teams would be created and deployed, providing on-the-ground support to current rough sleepers. The second component of our strategy is the construction of 1,500 modular housing units. Modular houses are prefabricated units that take approximately 4 to 6 months to build, so a modular housing site can be constructed efficiently. Each unit also has a high-quality, fully functional interior that provides a space for rough sleepers to live with stability, autonomy, and dignity. As the units are built, mobile wellness teams would be able to support rough sleepers as they transition into the new units. Our strategy also includes the integration of employment services. The employer incentive tax credit would incentivize organizations to provide skills development opportunities to help former rough sleepers find gainful employment. Benefits of this program include its flexibility and its responsiveness to the diverse needs across different Ontario regions. A modular housing community would look different in Thunder Bay than it would in Toronto, because this is not a one-size-fits-all approach. It would also include continued community engagement to ensure that the program meets the needs of both rough sleepers and surrounding residents. And the ARC strategy would have strong scalability should the province choose to increase the number of mobile wellness teams and modular units built. We see this as a solution that has potential to be implemented nationally. Challenges of the program do include the risk that individuals are not willing to accept the support that's offered through the program, or there may be difficulties securing land for unit sites, but these challenges will be addressed in later slides. Next slide, please. So this slide provides an overview of the proposed implementation timeline for the ARC strategy if it were to be approved. Our recommended approach would entail end-to-end community consultation and engagement, including with rough sleepers. The province would begin this process immediately and continue to ensure community perspectives are incorporated into all phases of program implementation. We would also maintain a focus on the perspectives and the diverse needs of Black, Indigenous, and people of color throughout this process. After a first round of consultations, we would deploy the mobile wellness teams and begin developing the modular unit sites. The construction process, as shown here, would be broken into 2-year phases for a total of 6 years, after which we would recommend the reassessment and possible continuation of the initiative. So once the first groups of modular communities are operational, employment services would be offered to individuals who have successfully transitioned into the units. And throughout the process, the province would be working closely with municipal service managers and nonprofit organizations to ensure smooth and cohesive implementation of the program. We do anticipate that the program would allow the province to make progress quickly. So after being announced to the public, we expect the province could communicate that they have successfully identified the location of 10 modular unit sites across Ontario by September of 2022. And by November of the same year, we expect that the province could announce the successful deployment and operation of 6 mobile wellness teams. Next slide.
The proposed strategy would be implemented province-wide with 50 modular housing sites made up of 30 individual units allocated based on regional need. 9 mobile wellness teams would be dispatched to communities in the Greater Toronto-Hamilton area, Northern, Eastern, and Southwestern Ontario. Next slide, please. Mobile wellness team implementation would begin with the purchasing and outfitting of vehicles, followed by hiring and training of teams. Teams would include 1 peer support worker, an individual with lived homelessness experience, and 1 social worker. While on the ground, the mobile wellness teams would provide supports for rough sleepers, connect individuals to services, and place individuals on modular housing priority lists. Modular housing site selection would occur in coordination with municipal partners and service providers. Prefabrication, construction, and site selection site development would take 6 to 8 months, throughout which extensive consultations with rough sleepers, surrounding communities, and businesses would occur. And finally, integrated employment services would be connected to both wellness teams and modular site operations throughout implementation. The proposed strategy would also designate an ARC program coordinator to ensure effective delivery and governance of the initiative. Next slide, please. To help us understand key principles of the program, let us return to Sierra. After sleeping for the last 4 months in an urban encampment, Sierra notices the new mobile wellness team parked on the side street near the park. She strikes up a conversation with a peer support worker who connects her with mental health and resources and encourages her to attend the modular housing community consultations. Sierra attends, puts her name on a waiting list, and after a few months, she receives word that she has secured a spot at the new modular housing site in the neighborhood. While in modular housing, Sierra is connected to mental health and addiction supports. She also takes advantage of the employment services and workshops. And in no time, Sierra has secured a job doing something she really enjoys, baking at a local business. 18 months later, Sierra has secure and stable housing and continues to thrive at her job. Next slide, please. The ARC strategy would have a key focus on collecting better integrated data to help us understand and interpret rough sleeping and homelessness. We understand that this is a dynamic model, and as such, it is designed to better track how people are supported by all services. In tandem with data collection, this is how we propose to measure progress over the course of the initiative. The first measurement is based on the number of individuals we anticipate will move into modular units, retain employment, and move on to sustainable housing. Reduction in emergency calls and visits takes into consideration success rates of similar housing first initiatives in Alberta and employment programs in the US. Next slide, please. As outlined by my colleagues, the cost of inaction on this issue is great, and funding allocations have not kept up with current needs. According to the 2021 Auditor General Report in Ontario, since 2013, funding approach for major provincial homelessness programs has been based on historical spending as opposed to responding to immediate regional needs. Updated investments are required to foster an effective, empathetic, and lasting response to the current crisis. The proposed strategy would cost the provincial government net new costs of $639.1 million over a 6-year period. The funding is broken down here to represent costs per 2-year phase. A formal program review in year 5 would be established to determine project continuation. And you can also see here that there are significant provincial and federal offsets available to us. We are confident that the federal portion of offset contributions can be further increased to reflect Ontario's fair share of national allocations. Detailed information on funding and proposed offsets can be found in the appendix. Next slide, please.
So here we've highlighted some key risks, but strong mitigation strategies. There is a high risk of NIMBYism from surrounding communities, but we will also prioritize open and honest communication throughout this process. We would also promote communication that the ARC initiative would ease their worries in the long run because we're planning to return some public spaces to their intended use by reducing the number of people sleeping outside in parks and public areas. It's important to keep in mind that this may take some time. However, in the long run, we are confident that our strategy would build trusting relationships. Our second key risk would be in securing appropriate land for modular housing unit development. However, we plan to mitigate this risk by converting more underutilized locations using the as-of-right zoning regulations. We expect some reluctancy from our sleepers and homeless individuals to accept our services and remain housed at first, but the peer-to-peer element assists in building the trust needed for our initiative. Lastly, we want to strive for continued consultations and negotiations with the federal government to secure our fair share of federal funding by making the case on core housing needs. Next slide, please. Based on our thorough consultation and understanding of advocacy groups, we can expect some reluctancy on account that our proposed strategy may be seen as a quote-unquote Band-Aid solution. However, after speaking with representatives, we've assured them that this would be a stepping stone in the right direction to improve the care for rough sleepers and homeless individuals. Additionally, we expect some hesitancy from nonprofit service providers with our initiative due to their concerns on whether or not our initiative would address those who are most in need. But we've also communicated that our initiative would give them the opportunity to collaborate with us in this province-wide initiative, and that this is an opportunity for effective collaboration and support for frontline community partners. We would also expect the support of municipal organizations such as AMO and AMSA, as this will invite them to have greater involvement in important decision-making and enhancing collaboration with the provincial government, and that the ARC initiative would reduce strain on first responders and hospital services. Next slide. Next slide, please. Our communication strategy would surround 5 key messages. First, we aim to reassure rough sleepers that we want to regain their trust and work with them. We also aim to reassure the surrounding communities that we are open to discussion and we want to give them a chance to address those concerns and show that they are being heard. We also aim to reassure the Ontario general public that we are working hard to collaborate with all orders of government so that we can build strong and healthy communities by helping those who are most in need. We aim to communicate to service providers and municipalities that we want to alleviate that pressure that is on them with the element of support and strive for continued partnership. Lastly, we would like to convey to Indigenous peoples that we are strongly committed to confront the overrepresentation of Indigenous peoples who are rough sleepers and homeless through meaningful partnerships to build strong and healthy communities together. Next slide, please. We thank you for listening to our presentation, and we will open the floor to questions.
Well, team, thank you very much. That's a very comprehensive package you've given us, and we do have some questions. I want to start by turning to Susie McDonald. Susie, do you want to start?
Yeah, great. Thanks very much for the presentation. And I haven't had a chance to review your annex, so maybe we could talk that through just quickly, because I think the federal government might say that they've already invested significantly in this space through the National Housing Strategy, Reaching Home, which has just been topped up, rapid housing, etc., and that Ontario has already received its fair share. So what makes you think they'd come back to the table on this particular issue? What do you think their role should be or could be in rough sleeping when they've already invested so heavily in housing?
Thank you for that question. Yes, so currently Ontario overall ranks 3rd in Canada and 1st in the provinces in terms of core housing need. And recent financial estimates of allocations estimate that Ontario, based on those key figures, would include has the potential to receive 490 more from the National Housing Strategy based on that core housing need. So we can make a good case for more money, considering that this initiative also aligns with the federal Reaching Home strategy to reduce homelessness in Canada by 50% by 2027, 2028.
Susie, are you satisfied with that answer? Just okay, all right. Okay, so after Susie McDonald, let me turn to Janet Golding.
Great, thank you. And thanks very much to the Tiger team for your presentation. As your presentation shows, the challenge of rough sleeping is complex with lots of moving parts and lots of considerations. So I'm wondering if you could just in a sentence or two think about what the key message is we want to give to the Premier in terms of what is the issue here and what is the core of your solution?
Can you put it in 1 or 2 sentences, folks? Who wants to take up that challenge? Nora, or so who wanted to, Kate? Doesn't matter to me. Alicia, sorry, Alicia, go right ahead. I'm sorry, there you are.
Thank you very much for that question. Our communication strategy to the Premier about our ARC initiative would be that this is an accelerated and targeted effective response that's going to provide wraparound on-the-ground supports by boosting, enhancing services that are offered and transitioning individuals into housing as quickly and efficiently as possible.
Okay, thank you very much. That's good. Janet, any follow-up on that?
Yeah, could I just go a quick follow-up? Thank you very much for that answer. And I think your message around the importance of wraparound supports is key. If I understand your proposal well, the idea of choosing modular housing sites and then having your mobile wellness teams connect with those sites is sort of an essential element. I'm just wondering though, if you could comment on the availability of the kinds of wraparound supports that need to be available sort of just generally across the province, right? So as you pointed out, mental health, addiction, other kinds of services are key. So do you feel that you have that kind of adequate level of support available?
Yeah, thank you very much for that. We do feel that we have adequate support that's available in the province, whether it be mental health support, addiction support services, or health services in general. So part of the initiative is that the mobile wellness teams will be collaborating and working cohesively with those services that are already in place, simply building on the good work that we know that they're already doing, working with rough sleepers right now.
Okay, thank you. I'll turn now to James Hughes. James.
So 2 questions. I think I'm breaking the rules doing that, but I can't resist. First of all, you seem to have rejected as part of your policy proposals, the prevention first piece because it's too long, takes too long, and it's too expensive. I just want to understand or hear from you a little bit more about that, because otherwise your mobile teams and your the other components of the ARC strategy will be ad infinitum. You're setting up to actually continue a supply of homeless people if it's not being prevented that would necessarily use those services. So one piece on those at imminent risk of homelessness. And then the other piece is about the role of the nonprofit sector in terms of the ARC strategy. What do you see as its role in both the design and implementation?
Who wants to take that one? Alicia again. Yep.
Thank you very much for that question, the 2-part question there. So as per your first part of the question, we did not go with the prevention first strategy as our recommended approach because it would be a longer term initiative. But we do think that it is still a viable option, and we would absolutely be tracking opportunities to potentially implement those options in the future. We do know that boosting Ontario's supply of affordable housing is important as well. But we believe that the province is already doing good work in that area. So we're confident that with the employment service integration aspect of our program, the individuals who are transitioned through our program will be able to find opportunities to find stable housing after they transition through the units. Now, as for your second part of the question, we anticipate that nonprofit organizations are going to have strong involvement in this initiative. We're going to be working collaboratively and cohesively with those organizations to ensure that they are at the table every step of the way. And part of that will be through the implementation of the ARC coordinator.
Okay, thank you. Let me move now to Pam McCurry.
Thank you very much for the presentation. I'd like to touch on the federal government's role a bit again, please. You mentioned that that there was, I think you said about 490 million still on the table from the housing strategy that should be available to Ontario, and that your rationale in terms of asking for that money, asking for more, is that after all, the provinces and the federal government's objectives are generally aligned in this area. So, you know, we're trying to do the same things, give us the money, we've got the money. But are there any other rationales for the federal government to pitch in more? You've got an Indigenous population. Are there any other reasons why the federal government might want to chip in more? Are there any legal obligations?
In other words, anything other than just fair share. Alana, go ahead.
Anything
Alana.
other than just fair share, yeah. And after all, we all want to get to a better place.
Alana, go ahead.
Yes, thank you. Can you please take us to slide 23? Yes, so this slide breaks down current funding commitments, and as you can see, the provincial commitments are quite substantial. We also have commitments from municipal partners, and then we have the federal commitment here. As I mentioned before, we can make a good case for more money from the federal government as the core principles of our strategy are aligned with the federal principles outlined in the Reaching Home strategy. Fundamental to that as well is the collection of data. That is a very key part of our initiative and a key part of the Reaching Home strategy. So we expect their support based on this so that we can better understand the current crisis and generate and respond to that accordingly.
Okay, thank you. Let me turn now to Trina Fraser. Trina, any question from you to our team? Sorry, I can't see Trina. Maybe she's frozen. No, okay. You're okay. You're good. Yep. Good. Go ahead. Go ahead, Trina.
Thank you for your presentation. And you did speak a lot in regards to the fact that there are high numbers of Blacks and Indigenous within the encampments. And you talked about having wraparound services. And in looking at mental health, do you fear that there are currently enough culturally appropriate services that could support those folks living within those encampments? And if so, how? And if not, how could society support that to be better?
Thank you for your question. So simply due to the lack of data, which was mentioned as a key obstacle to resolving the current crisis, it's unclear about the exact numbers of how many Indigenous and Black, Indigenous, and people of color are struggling with mental health specifically. However, a key component, a key benefit of our proposed ARC strategy is to ensure that the individual needs of these unique communities are met, however that they feel need to be implemented. So in that sense, we would certainly collaborate with the affected communities in developing culturally appropriate approaches in close collaboration with them throughout the entire implementation.
Thank you.
Okay, thank you. Let me go to Alan Northcott.
I'll just take you, thank you, by the way, for your presentation. I want to take you quickly back to the question about nonprofits. You know, there's a huge range of nonprofits in the space with a range of different capacities and expertises. What do you do to ensure that they're, you know, when you're working with them, that the value they provide is optimized?
Thank you for that question, Minister. So a key issue that's currently been identified as a problem in the disconnect of services is the lack of communication and the lack of time to simply develop stronger and more coherent relationships between non-government organizations as well as the municipal government. So in that sense, throughout our strategy, as well as utilizing the role of the service coordinator, we would ensure that these relationships are more coordinated, essentially. So that would be certainly a key consideration throughout the entire program.
Okay, thank you very much. Gosh, are there any more other questions from the people? I mean, I'm sitting here and I've enjoyed this presentation very much, and I don't have a specific additional question to ask of you folks. Let me say that I did appreciate your success measures, the fact that you had on, I think, slide 15, you had just some clear measures of success, which I think if we could just go to that briefly there. There we go. So I take it that that you would be using these measures to determine, to assess and evaluate the effectiveness of the various elements of your program. Is that correct?
Yes, it is.
Yeah. Okay. All right. Well, that's good. Okay. If there's no more questions from the panel, let me say to all of you, thank you very much. This is a very comprehensive and most interesting proposal from Ontario. And thank you very much. Thank you all very much.